In the event of an emergency, are you prepared to lend a helping hand? Workplace accidents, automobile accidents, injuries at home or during recreation can expose you to serious diseases such as AIDS or hepatitis B. What can you do about it? Stand by and watch? Do nothing? Or what? The answer is to be armed with knowledge and information about blood pathogens, then take the necessary precautions to protect yourself from potential hazards. Please keep in mind this video is not designed to list all the potential hazards, nor is it designed to serve as a comprehensive training program related to AIDS or hepatitis B. Each organization is responsible for developing their own policies and procedures relating to bloodborne pathogens and following local, state, and federal regulations and standards. Each organization must refer to their own medical and legal advisor for specific information for developing policies and procedures. Okay, let's begin with some basic knowledge about potential bloodborne pathogen hazards and how to avoid the risks. Much of the information about AIDS is well publicized, particularly those persons working in the healthcare field, dentistry, emergency medical personnel, police, and others who are regularly exposed to blood and body fluids. The risk goes much farther, as your exposure to these diseases can occur in a matter of seconds, anywhere, at home or work. Let's take the situation where an employee is injured and needs emergency first aid. What do you do? Do you rush in and put a bandage over the wound, or do you wait for medical assistance? First, let's discuss the diseases. The AIDS virus affects the immune system. Everyone has an immune system to help fight diseases, infections, and other health problems. If you catch a cold, your body goes into action to fight the virus. Some people have better immune systems than others, so some people catch fewer colds than others, or have a tendency to recover from the effects of the virus sooner. Viruses are incapable of living alone. In order to survive and reproduce, they must use other healthy cells in your body. The human immunodeficiency virus, or HIV, is the AIDS-causing virus. Once the HIV enters the bloodstream, it sticks to and adheres to certain cells. These certain cells begin taking direction from the HIV virus, creating new viruses. The AIDS virus directly attacks the cells that are meant to fight disease. As a result, an AIDS victim becomes susceptible to diseases which a healthy person can usually fight off. The hepatitis B virus affects the immune system, but the virus itself does not have a direct effect on the immune system, as does the AIDS virus. There is no current vaccine to immunize against the AIDS virus. However, there are passive and active immunization for hepatitis B. Unless you work in an area such as hospitals, clinics, or other healthcare areas, you probably will not be immunized against hepatitis B. The words bloodborne pathogens are the key words when discussing how these diseases are transmitted. A bloodborne pathogen is a very small organism that is carried, reproduced, and spread in the blood or blood products, and is capable of causing disease. The HIV virus has been found in blood, semen, vaginal secretions, breast milk, and other body fluids. There are a variety of ways to spread the disease, such as sexual intercourse and others. But let's just say that the potential for exposure exists in a wide variety of methods. However, it's important to remember that direct contact with blood, body fluids, or tissue of infected persons is about the only way to be exposed to AIDS. Hepatitis B is transmitted in much the same way as AIDS. It is a serious condition that requires protection and prevention from exposure.
Hepatitis C is a blood-borne infection caused by an RNA virus, hepatitis C virus, HCV.
Hepatitis C is a virus that is passed similarly to hepatitis B. It's passed through blood contact, rarely through sexual contact, although it can be. And people that share needles and people who had blood transfusions before the early 1990s are at great risk for actually having hepatitis C. And it affects the liver by causing usually inflammation of the liver with chronic scarring of the liver. And people who have hepatitis C are at risk for developing cirrhosis after many, many years, usually 20 years after exposure.
This virus causes damage to the liver that may result in chronic infection and disease. HCV is unrelated to any of the other known hepatitis viruses, A, B, D, and E, and infection is identified by the detection of antibodies to the virus in the blood. Unlike many other infections, the presence of antibodies in the blood does not signify recovery. Over 85% of infected individuals fail to clear the virus spontaneously and develop chronic infections. Viruses can't be seen by the eye or even under a microscope. It takes an electron microscope to see them. Worldwide, some 170 million people are chronically infected with HCV, with almost 4 million of them in the United States. There are an estimated 3.9 million Americans affected with hepatitis C, of whom 2.7 million have chronic hepatitis C, 75% of which have no idea they're infected and capable of transmitting the disease to others. About 85% of infected adults will develop chronic or long-lasting hepatitis C infections. To put these numbers in perspective, that's more than 3 times those infected with HIV or the virus that causes AIDS. HIV is spread when blood or body fluids from an infected person enter the body of a person who is not infected. The Institute of Medicine classifies hepatitis C as an emerging infectious disease. Hepatitis C is serious for some persons, but not for others. Most persons who get hepatitis C carry the virus for the rest of their lives. Most of these persons have some liver damage, but many do not feel sick from the disease. Some persons with liver damage due to hepatitis C may develop cirrhosis or scarring of the liver and liver failure, which may take many years to develop.
Okay, we've identified some of the potential hazards, but how does this affect people who don't work in healthcare facilities? It affects everyone, no matter where you work. If you provide assistance to an injured person, you can't tell if the person has AIDS or hepatitis. You have to protect yourselves as much as possible in the event you could be exposed to the virus through contact with bloodborne pathogens. Personal protective equipment is extremely important when exposed to bloodborne pathogens. But there's a reluctance to use personal protective equipment for routine first aid procedures or when responding to an emergency. The facts are quite clear, however, that some basic personal protective equipment is required for protection. Masks prevent exposure to mucous membranes of the mouth and nose from droplets or splashes of blood and body fluids. Proper wearing of the mask is as important as the mask itself. Wear protective eyewear or a face shield when droplet or splashes of blood and body fluids may contaminate the eyes, mouth, or nose. Gloves are extremely important. It's up to each organization to provide proper gloves, and equally important is to train everyone how to use gloves. Latex gloves are not puncture or tear resistant, so be sure that the selected glove provides the wearer with the desired protection. Never reuse the gloves after they have come in contact with a bloodborne pathogen. Change gloves after each contact. Personal hygiene and housekeeping are very important. Wash your hands frequently and when cleaning restrooms, cafeterias, and other public areas. Be sure the person cleaning the facilities understands how to clean properly and how to sanitize. Cleaning is accomplished by washing and scrubbing with detergents. Sanitizing is the process of killing harmful bacteria by using certain chemicals such as germicides or other sanitizing agents. 1 cup of liquid household bleach in a gallon of tap water makes a good sanitizing agent. Mouth-to-mouth resuscitation is potentially hazardous, as direct mucous membrane contact is normally required. You can reduce this hazard by using mouthpieces, resuscitation bags, or other ventilation devices. When practicing CPR, be sure to clean and sanitize the mannequins after each student has used it. Your CPR instructor should be familiar with cleaning and sanitizing the mannequins after each use. Public safety officers such as police, fire, rescue, even prison security personnel are particularly at risk, as their jobs require them to come in contact with persons in a wide range of emergencies, and even in routine jobs, such as when working with blood-covered clothing or personal items. One of the most potentially hazardous areas is needle sticks. This can be a major source of infection if someone accidentally sticks themselves with an infected needle. Police officers searching automobiles or individuals can be exposed to needle sticks. Walking along the beach and getting stuck with an infected needle or bottle or glass is a potential exposure. The moral of the story is simply this: the AIDS virus is here, and there's no known cure. The hepatitis virus is here, and exposures to hepatitis is extremely dangerous. The exposures are very real, and the only prevention is to exercise caution, use common sense, and of course, follow your organization's policies and procedures relating to bloodborne pathogens. Wearing personal protective equipment such as masks, gloves, and even eye and face protection will go a long way to reduce the potential hazards of AIDS and hepatitis B in the workplace. Thank you.
The Bloodborne Pathogen Standard has many requirements and responsibilities that must be provided, such as a comprehensive exposure control program, needle stick injury prevention, personal protective equipment, medical records, record keeping, and much more. What we would like to do in this particular program is list the 14 elements of information and training that is required for your bloodborne pathogen program to meet OSHA standards. You might say this would be a great checklist to ensure that your program is up to date and is in compliance. Required information and training. This information is taken directly from OSHA standards relating to bloodborne pathogens, 1910.1030 G2. The first part of required information and training is employers shall ensure that all employees with occupational exposure participate in a training program, which must be provided at no cost to the employee and during working hours. If your job reasonably anticipates you being exposed to blood or other potentially infectious materials, or OPIM, this training would apply to you at the time of initial assignment to tasks where occupational exposures may take place. This means when you are first assigned these tasks, training must be provided. Training must be provided at least annually thereafter. Annual training for all employees shall be provided within 1 year of their previous training. Employers shall provide additional training when changes, such as modification of tasks or procedures, or institution of new tasks or procedures, affect the employee's occupational exposure. The additional training may be limited to addressing the new exposures created. Material appropriate in content and vocabulary to educational level, literacy, and language of employees shall be used. Basically, this standard means the company must train at the educational level and literacy competence of the individuals and the language used by the employees. If Vietnamese is the language spoken by employees, then training must be in that language. 14 required elements. The training program shall contain, at a minimum, the following elements. Element 1. An accessible copy of the regulatory text of this standard and an explanation of its contents. Element 2. A general explanation of the epidemiology and symptoms of bloodborne diseases. Epidemiology is the study of factors affecting the health and illness of populations and symptoms of infection of bloodborne diseases. Element 3. An explanation of the modes of transmission of bloodborne pathogens, generally, how bloodborne pathogens are transmitted through exposure to these pathogens. Element 4. An explanation of the employer's exposure control plan and the means by which the employee can obtain a copy of the written plan. This is the employer's exposure control plan and where the employee can obtain a copy of the plan. Element 5. An explanation of the appropriate methods for recognizing tasks and other activities that may involve exposure to blood and other potentially infectious materials. Element 6. An explanation of the use and limitations of methods that will prevent or reduce exposure, including appropriate engineering controls, work practices, and personal protective equipment. Element 7. Information on the types, proper use, location, removal, handling, decontamination, and disposal of personal protective equipment. Element 8. An explanation of the basis for selection of personal protective equipment. This training explains why particular personal protective equipment is used and the purpose of wearing it. Element 9. information on the hepatitis B vaccine, including information on its efficacy, safety, method of administration, the benefits of being vaccinated, and that the vaccine and vaccination will be offered free of charge. This type of training would cover these aspects of the hepatitis B vaccine and information for you to make a decision to take the vaccine or decline it. Element 10. Information on the appropriate actions to take and persons to contact in an emergency involving blood or other potentially infectious materials. This information helps you take proper action in the event you are exposed to blood or OPIM. Element 11. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and the medical follow-up that will be made available. Element 12. Information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee following an exposure incident. Element 13. An explanation of the signs and labels and/or color coding required by paragraph G1, and Element 14, an opportunity for interactive questions and answers with the person conducting the training session. If the training is conducted online, there should be an opportunity for you to ask questions to a topic expert, generally via telephone or email. Other requirements. The person conducting the training shall be knowledgeable in the subject matter covered by the elements contained in the training program as it relates to the workplace that the training will address. The Bloodborne Pathogen Standard is very comprehensive and requires compliance in all parts of the standard. Employees who may reasonably anticipate being exposed, such as first aid providers, emergency responders, hospital workers, and similarly employed persons, must be trained. Of course, all training must be properly documented. Documentation is a mandatory requirement on almost any training that is conducted.